Namaste. Welcome everyone. We do have the doctor today. I hope or comments or any suggestions, feel free to share. Next week, we will be talking about gastrointestinal issues and digestive issues. So, because that actually ties in very well with this week's focus on diabetes. Okay, so let me come close and see what we have here. And let's see if he can show you the slide again, but if not, I have got this handout here. So this is the 10 asanas for diabetes. Yeah, that's the right handout. I'm just making sure that, yeah, he has got it there.
This is Dilip.
Yeah, Dilip, how are you?
I'm doing.
I can't get my video to work, but I got a quick question. These diabetic poses, what you talk about, I've seen, I do it from time to time. My question is there a set of exercises or yoga poses one has to do for backache? You had 10 of these for diabetes, but do you have any listed for yoga, for a backache?
Okay. Is Abha here? Are you listening?
Dr. Sarkar, I will let you address that. It's good to see you.
Yes, Sudhir. The answer to it is very simple, is that we have, asanas, pranayamas, meditation, all for every particular disease. It's called a disease-specific yoga therapy.
Yeah.
But primarily, in our Western concept, this is called a reductionist approach. Reductionist approach means I have a fever, I take Tylenol. But Tylenol is not going to correct your root cause. It's called a system correction.
Okay.
So basically what it is, that all the therapies we prescribe, there is not a asana, a pranayama, a meditation for a disease.
I understand.
It is a holistic, it is a global approach, and primarily approach is for, say, even in a back pain. In a back pain, what happens that you really don't have the pain from the slip disc, from spinal stenosis. It irritates a nerve, then it gets a muscle contraction. And all the pain fibers are in the muscle contraction. So therapy primarily is, we call it a progressive muscular relaxation.
Yep. Okay.
So we'll give you a pose, but we'll tell you to hold into the pose. And to do that, you need to prepare yourself. So if you have noticed what Abha practices every day, she practices a little bit of, it's called a Sukha Vyam. We call it a relaxation response. You prepare in the same way that you need to do. It is actually, remember one thing: this whole yoga as a therapy is not only asanas, not only pranayamas. This is purely a daily practice. It's a part of your life. And it is a part of your daily routine. It's a part of your even lifestyle. We call it a lifestyle medicine. And it is extremely slow medicine. But it is a very strong and permanent medicine. It works in the root cause. We have hundreds and hundreds of people, who is off medication. They're enjoying a good quality life. But if you ask them, only one question answer you get: a daily practice. So if you incorporate a daily practice in your lifestyle, if you have a diabetes, we can guarantee you that that blood sugar is bound to come down. You're going to get the medication-free, disease-free life, because whole diabetes is a lifestyle-related disorder. So back pain, like a back pain we have called a supported forward bend, back bends. So the back bends on a mat. Like if you're in a mat, if you do an unsupported back bend, the back pain gets little worse.
Yes.
So asanas like a cobra pose, Bhujanga asana, Shalabhasan, Dhanurasan, and Apa does it in every day or every class, every way. Back bend on the mat is primarily. And then for the back pain, you need the relaxation of the spinal muscles. So mountain pose, Tadasana, Katichakra asana, Tijak mountain pose. So it is all boils down to relaxation. But you have to do it every single day. You know, it's not that I'm going to do 1 day or 2 days a week. And other important thing about back pain and yoga is it is not going to go away. It is going to stay with you. You may have a little bit of a little discomfort, a nagging pain, but a severe acute pain is not going to come back.
Yeah, I'm looking simply for a severe pain should not come back. So
yeah, it is severe pain. You know, we all had it. I had a serious pain, and we have a lot of people who has it, and we do daily practice. But as long as a few things you need to do is very important, and for all of you to hear this, that you need to keep your spine straight. You sit down with your spine straight. When you walk, you keep your spine straight. So the moment you keep your spine straight, what happens? The muscles on both sides of the spine gets a relaxation. So normally what happens, I'm standing up, my skeleton is going to fall in the front. So the muscles on both sides of the spine, they're contracting, they are keeping me straight. And that is the tightness. By able to just keep my, see, I'm sitting down, I'm always sitting down with my spine straight, you know. So, you know, I eat like this, I drive my car like this, and that is a primary beginning to incorporate in our lifestyle. And we all use the same word all the time, me and Abha. This is our sutra. Abha, Karo Yog Raha Nirog.
Yes.
that's true.
Karo Yog Raha Nirog. And I tell you, with this online thing now, and I share with Abha, we have
You need to translate that, Dr. Sarkar.
We don't need to translate anymore. Everybody knows that. Huh? Karo means do, keep doing. Yog, you know, practice, daily practice. Raho means stay. Nirog means disease-free, healthy. If you keep doing a yoga every single day, you will stay disease-free and stay healthy. And
that's good. So at least I know, but I'll try to avoid a couple of poses which give me like a backache. So as soon as I start feeling it, I gotta back off.
No, you don't do that thing. Most important thing is when you are practicing, you go in a very slow in stages to the point that you don't have any pain. The moment you get a pain, that means you have created an imbalance in your physical body. Two things you need to look into when you do asana practice: no pain, and that's called effortless breathing. Any practice you do, your breath has to be completely effortless. You'll be able to talk, you'll be able to sing. You breathe out longer than breathing in. Do not practice after taking a pain medication. If you take a pain medication, your body's defense pain goes away. So me and Ava, we talk all the time that we teach everybody, you start where you are. You start where, you know, little short of pain. If you get a pain, you back off. Exactly what you're saying. There are asanas which you got a pain, you have to back off. But you stay in the pose a little long enough, slowly and slowly you will see, you will progress. And this is a function of our brain we call it habit forming. We call it a neuroplasticity. So always start where you are. It is non-competitive. And we call it a, what do you call it? Money back guarantee, huh? Money back guarantee. You will get better, huh?
Definitely it will help. I'm pretty sure, because the thing is, I feel that I've gone beyond certain directions, and then it gets worse.
Yes.
And so I
you,
just need to do effortless.
yes, you back off.
Will help.
You back off and you listen to your body. Be sure you don't take any pain. Don't take it to Motrin or to Advil before your any kind of physical exercise. You should do without any pain medication.
Yeah, I'll try to wean off. I've been taking a couple of Advils at a time, but now I'll wean off and then I'll see how we can take care of it.
Especially before the practice, try not to do pain medication if possible.
Oh no, the thing is, I took something 6 hours back or 8 hours back.
That will be great.
Not
That'll
now.
be great.
That's good. So thank you
I
very
see.
much. And how you are
Thank
doing,
you.
otherwise?
Yes, I see Susan, I see Linda. Who else I see? Sudhir is here. Malini is here. Very nice. Any other Charlotte is here. Charlotte and James. Very nice seeing you. Who else you are seeing, Abha?
Yeah, same people. I see Linda Robinson there. Hi, Linda.
I see Susan here too. Susan and Russ.
Yes, but I think her camera is turned off. Oh, there it is.
Here she is. How are you doing? Nice seeing you. We are all going. Hey, Russ. Hey. Your microphone is mute. You can talk.
We're happy to be here. Thank you, Abba. That was a wonderful class.
Oh, thank you. Thank you for joining in.
Here comes Charlotte. Hi, Charlotte.
Charlotte, your microphone is on mute.
Can you unmute your microphone?
I'm unmuted now. We've been here.
Yeah. You're unmuted now. We can hear you now.
Yes, and I can hear you.
Mm-hmm.
I can hear you. So is that your practice room?
That's what?
You're in your practice room?
This is my practice room. My practice room is on the other side,
Right.
one end. This end is my, what do you call it? I was sitting in my formal presentation room, huh?
Living room?
Living room, there are
Yeah.
two ends, one end we do the practice, other end
Okay.
so the morning when you come to the practice class, I'm on the other side,
Uh-huh.
in front of a laptop.
Mhm.
And this is the one we teach from my Zoom meeting, yoga teachers training classes. The rest of the teaching I do from here.
Okay.
And doing more teaching now online than before.
At least you don't have to travel.
Exactly. You don't have to travel. But other thing is that people can find you very easily now.
You're always in the same place, huh?
Yeah, they find you in one place. So Linda, how you doing?
Very well, thank you.
How's your activity going on? You're pretty active.
Oh, I'm having lots of things, just writing and doing yoga.
How about your book? Is the book ready now? Is the book coming out?
The book, my last book is already out, and
That was number 2.
that was
The last book was number 3.
that was number 2.
Number 2. So number 3 now. Time for a number 3.
I'm taking a break first.
Okay. There's a couple of messages here. Do you see that,
Okay.
Abha? What are the messages here? From Susan. Thank you, Abha. Thank you for. Okay.
This
Thank you,
Patty,
Abha.
thank you to everyone.
Oh, where's Patty? I hear her. Oh, there. She's the iPad.
Yeah, I'm the iPad without a name because I don't know how to name it. But thank you for the class. It's great. Thank you, Dr. Sarkar.
Hi, Patty.
Can you turn your camera on? We don't see you.
After I do my hair this week, I'll turn my camera.
Oh.
I don't want to scare anybody.
Actually, this is.
All right, have a good week, everyone. I have to go.
Thank
You, Patty, for
Patty.
joining in. Yeah, see you next week.
Thank you.
Thanks very much. I'm off now.
Thank you, Sudhir. So,
Thank you, Sudhir ji. Pranam.
any, Sudhir, if you need any list of the asanas, you can, we can email it to you. We have all the list. Sudhir, are you listening?
Yeah, I'm listening. I'm here.
If you need any, we have all the disease specific asanas, disease specific pranayama, we have a list. We can share with you. But you adopt a daily practice of yourself, and you will see your back pain will be gone, blood sugar will come down, blood pressure will come down. You know, it is amazing practice, you know, unquestionably.
Yeah, I'll do it. I'll take one step at a time. Okay.
Yes, that's great.
Yeah, the good thing I used to do it earlier. Now I backed off, and now I got to get back. Because now maybe there's a little more free time. Don't have to go to the office anymore.
Mm-hmm. And we're in a position that if we don't do one day, our body tells us you have not done it, huh?
Yeah.
Well, we have imprinted memory now.
Yeah, the body will tell.
We cannot leave home without doing it, you know. It is just imprinted memory on us.
And that's it. So thank you very much, Dilip.
Thank you, Sudhir. Thanks for joining.
We'll talk to you guys sometime next week.
Oh, you're gone.
Okay, bye-bye.
Yeah, bye-bye.
Thank you.
I'll join you too at the end, you know, if you, I have, most of the time I have a little time on the afternoon.
Okay.
Okay.
All right.
Okay,
Thank
Linda,
you.
we'll see you next Saturday.
Thank you.
Okay. And Abha, I'll see you next Friday. Kemon acho?
Yeah.
Friday time.
I love your Bengali sessions. Yes. It sounds, I mean, I don't understand all, but it sounds beautiful.
But did you see that 3,000 people joined? You know, I mean, I don't know where all the people are coming from.
That
you know?
is incredible.
Incredible.
Well, I'll join one of the Bengali sessions also. I'll try next Friday.
Friday. It's a Friday morning at 10 o'clock. Facebook Live. Yeah. Other